Story 1. My 2-year-old had diarrhea. Then, 2 weeks later, it was even worse. The health department inspected mine and my grandmother's house to be sure we weren't doing something wrong or living in unsanitary conditions. My grandmother was absolutely offended, but nothing was noted. 3 months later, she still had diarrhea. 10 months later, she was almost 3 years old, losing her hair and weighed 23 pounds. They finally found a tumor lodged between her liver and kidney. It was neuroblastoma. Her tumor was saved for further research. Doctors at the Children's Hospital said the diarrhea was what saved her. Neuroblastoma doesn't typically cause diarrhea. She is now a big, healthy college graduate. Thank you for all the support. This has been amazing. Who knows? Maybe we all just saved someone with this information. Yay to us for surviving and thriving. Story 2. I am currently being treated for stage 3 breast cancer and did not have any symptoms at all. Ladies, get your mammograms. Story 3. A 9-year-old niece was extremely lethargic. Other than that, she was fine. The doctor decided to run some cancer screening tests. She was diagnosed with leukemia. She died of an infection during her last round of chemotherapy. Story 4. I had some unusual blood test results that were not quite right, so my doctors examined them more closely. There were minor aches and pains that I thought were related to something else I had in the past. I still have not experienced many symptoms. The positive aspect is that it was detected very early. The doctor told me, "This is not going to be the reason you die," which is an oddly comforting yet ominous way to deliver a cancer diagnosis. Story 5. My dad, age 36, had severe headaches. He was diagnosed with brain cancer and was given 3 months to live. Chemotherapy extended his life to 9 months. My mom, age 45, had loose bowels and very aggressive cancer that had already spread to her liver. She was given 12 months with no options for chemotherapy, radiation therapy, or surgery, only painkillers. She passed away 4 weeks after diagnosis. Story 6. Blood in my stools off and on. I was foolish and ignored it for years, but had recently started a new medication that worsened my symptoms, so I decided it was finally time to get it checked. I, a 38-year-old female, underwent a combined endoscopy and colonoscopy, during which they removed a 2.5-centimeter polyp. It looked normal, and the doctor did not seem concerned. However, the results came back positive for cancer. 2 months later, I had surgery to remove 2.5 inches of colon on either side of where the polyp had been removed. Everything came back negative. It was officially listed as stage 1 colon cancer. I was one of the extremely lucky few. Do not ignore symptoms for years. Get your colonoscopies. Story 7. I was diagnosed with stage 3 occult breast cancer. I had a new kitten who obsessively licked my armpit. A few days later, I felt a fullness in the same armpit. When I examined the area, I found a lump that led to my diagnosis. I had no other symptoms and was too young for routine mammograms, which would not have helped anyway because occult breast cancer does not show up on breast imaging. The cancer was very aggressive. I would have been dead in 6 months if it were not for my cat. He saved my life. Story 8. Just complete exhaustion. I was falling asleep during all my daily tasks. I even started falling asleep while driving, which scared me a lot. I had to fight hard to get my primary care provider to do blood work. She kept saying it was related to my mental health condition, obsessive-compulsive disorder. Fortunately, at the time, I was caring for a nurse practitioner and told her what I was experiencing. She ordered my lab tests, and it turned out I had stage 3 liver cancer. My primary care provider stopped being my doctor after my biopsy results came back. Story 9. Extreme fatigue, the kind that made me take 2-hour naps each day after work and was not resolved with more than 9 hours of sleep daily. Story 10. I was mostly fine. I just had a bump in my neck and clavicle area and very bad night sweats, but otherwise I felt normal. Turns out it was lymphoma. I finally finished chemotherapy today and hope that I beat cancer. Story 11. My friend had headaches that kept her bedridden for days at a time. It turned out to be a glioblastoma in her brain that had spread to her spine. Story 12. I bumped my head on a car door. and it swelled up a bit. After a week or two, it seemed unusual that the swelling had not gone down. I went to see a doctor, and they found lesions indicative of multiple myeloma, which is an incurable blood cancer. My doctor estimates that I had the condition for 8 to 10 years before being diagnosed. It is not something that is routinely tested for. The only symptom that could have been an indicator was lower back pain, but since I am older and overweight, it was not surprising. Story 13. My dad had serious heart problems starting at an early age. It's hereditary. I had my coronary artery bypass graft surgery 10 years ago. Anyhow, my mom and dad were at the pharmacy waiting for prescriptions. My dad, as usual, tested his blood pressure there. My mom said, "What the heck? It's free." So she tried it out. Her blood pressure was very high. After talking to the pharmacist and thinking something was wrong with the machine, they tested again a few more times. He urged her to follow up with her doctor. She did. After extensive testing, they discovered she had stage 4 small cell lung cancer. She had no idea. I went to the oncologist appointment where he told her there was about a 5% chance of surviving 5 years. It's very hard to treat small cell lung cancer because you need to kill 100% of the cancer cells. 99.999% is not good enough. She lived about another 20 years and died of normal old age complications. She beat it somehow. Lesson learned. Never give up. Like Jim Carrey said in that movie, yes, there is a chance. Story 14. My mom had severe stomach pain. She got her stomach checked out, but nothing was found. They checked her pancreas. It was stage 4. 3 months later, she passed away. She didn't even make it to her second chemotherapy session. Please get your cancer screenings. Story 15. My mom kept vomiting this past Thanksgiving to New Year's. She seemed a little confused, but nothing alarming. It was flu season. Then she had a seizure on January 6th. She was diagnosed with the deadliest and most aggressive brain cancer. She has not been home since the seizure and will pass soon. Story 16. My general practitioner noted protein in my blood. A bone marrow biopsy revealed a high percentage of cancer cells. My oncologist says the disease has responded well to treatment, as shown by laboratory reports. Otherwise, I have not actually seen the disease. Story 17. My aunt was bleeding heavier than normal. For 8 months, she was told it was menopause and nothing to worry about. She went in and out of the hospital, knowing something was seriously wrong. After 8 months, she was finally diagnosed with stage 4 cervical cancer. Story 18. My brother had consistent toothaches, but he did not like the dentist. By the time they scanned his jaw, it was already riddled with cancer. He did not make it. Story 19. 0 symptoms. I, a 22-year-old female, was studying abroad and was the healthiest I had ever been. I had a routine checkup and one test led to another. I was diagnosed with Hodgkin's lymphoma, which is a type of blood cancer. This was in December 2024. I had to quit my university and come back home for treatment. 2 weeks from now is my last chemotherapy session. Cancer is a horrible disease. Story 20. My mother had breast cancer with no symptoms. It was detected during a routine mammogram. Thankfully, she underwent surgery for removal, followed by 1 year of chemotherapy and radiation therapy. She is now cancer-free. Story 21. My best friend used to get frequent painful headaches. Her father had medical books, and she would read them, convincing herself she had cancer. I thought it was so far-fetched because we were very young, about 20 years old. Imagine my shock when it turned out she did, in fact, have brain cancer. She went through treatments and was in remission. A year or 2 later, she got married and became pregnant. Unfortunately, the cancer returned. She had to make a decision. Continue with the pregnancy and forgo treatment, which she wanted to do, or terminate the pregnancy and start aggressive treatment immediately. Her husband convinced her to do the latter, but unfortunately, it wasn't enough. The cancer had spread. She passed away 2 months after her 24th birthday. Ironically, exactly 15 years later, my mother also passed from brain cancer on the same date as my best friend, February 15th. She got sick in November 2019 and passed away 3 months later. Her original symptoms were confusion, headaches, and brain fog. During her battle, she lost her hearing and her ability to walk. It was a quick decline in a short span of time. It has been 25 years since I lost my best friend, and I still miss her and think about her often. It has been 5 years since I lost my mother, and I think about her daily and miss her terribly. Story 22. So I don't know if I have it yet. Blood cancers take a while to screen for properly. What triggered the screening is that I regularly donate blood and plasma, and of course they test it for dangerous substances before using it. I had given plasma, waited the 2 weeks, and went to book myself in right on time. The app said I wasn't eligible to donate anything. I tried the website, same result. Weird. I called to find out what was going on. The lady on the phone looked at my file and said she was transferring me to the health team. They said they were mailing me a letter that I needed to take to my doctor because some of the values were off. Red blood cell count was below the standard range, and white blood cell count was well below the standard range. I went to my doctor and had to get another test done. I had managed to keep my red blood cell level by eating a lot of red meat for 2 weeks, which spiked my iron, but my white blood cell count dropped even further. The next test held the level steady. One more test to go, and if it's not back up, I'm probably getting a bone marrow biopsy to test for leukemia. What really worried me was that after the first test with my general practitioner, when things were getting worse, I had to explain that I've had a lot of computed tomography scans in my life, starting at 10 years old, and have had more than 6 since the start of the COVID-19 pandemic. I also had other exposure to hazardous radiation and worked with many carcinogenic chemicals at university, often being a bit careless about my personal protective equipment. He needed to consider me higher risk than the average person. One thing I will say is this: nobody tells you just how bad the waiting is. I have to wait a month for more blood work, the doctor is booked up so I have to wait a week to see him, and I can't see the results until then. Puts a real emotional drain on you. There have been multiple times when I've been on evening walks and get in my head about what to tell my family. I live alone, so how much support will I actually get if I need chemotherapy? Do I even tell my friends? I certainly can't tell the one who is pregnant and add more stress. There is a wedding coming up. How well will I be equipped to even go? I'm just wandering dark streets, lightly crying and freaking out behind my glasses. The waiting, man. Think of a really stressful exam you've had. Not sure if you'll pass or fail. How worried you were waiting for the results. Now multiply that by a level of, this may actually kill me. Story 23. At first, I exited this post because it was scaring me. But then I thought I should really read through all these comments to know the signs and symptoms. I am at the age where I should be getting yearly checkups and tests. Story 24. I had an incredibly small spot on my nose that would bleed if I picked at it. I admit I am a skin picker. This spot, slightly bigger than a pore and flesh-colored, would bleed longer than expected. Skin cancer. I am 38 and tanning was very popular when I was a teenager. Not just tanning beds, but also avoiding sunscreen when spending a day outside to get a little color or sun. One of the top songs at the time was "Soak Up the Sun." If you, like me, took no precautions in your youth to avoid sun exposure or when tanning, I cannot stress this enough. Make a full-body appointment with a dermatologist to check for spots. It is not just obviously dark moles that change shape or unusual spots you need to worry about. Can be insidiously normal-looking. Story 25. I found a hard lump in my breast in the shower with no other symptoms. I really thought it was nothing, but of course it was breast cancer at the age of 30. Because of this, we learned our family carries the BRCA1 gene mutation, and now everyone is getting checked. I am 32 now, cancer-free, but still struggling to process everything that has happened over the last 2 years. Cancer really is difficult. Get to know your body and have anything new or abnormal checked. Story 26. Losing 20 pounds in 2 months. Initially, they thought it was my gallbladder. I had it removed. I was still vomiting bile and feeling terrible. I was in and out of the emergency room so much that doctors, friends, and my then-husband thought I was making it up. An emergency room doctor made me take Ativan before he would talk to me. When I called my former mother-in-law, who was a pharmaceutical representative and knew some good doctors, she told me to get a psychological evaluation. I called my best friend in tears, and she told me this: call that person's bluff. Go in, but don't leave until they can prove it's all in your head. So I did. They took all my belongings away, and I talked with the doctor. Since I wasn't having a mental break, he asked me what was going on. Then he admitted me for observation. At the hospital, I asked a nurse if passing a lot of blood in stool was normal. She said no, got a doctor, and I had a colonoscopy a week later. I was diagnosed with stage 3 colon cancer at age 37. No genetic history, nothing. If I hadn't listened to my friend and my intuition, I would be dead by now. Story 27. I was in the army and was having increasing difficulty with physical training, especially running. The cancer I have is rare and mimics chronic obstructive pulmonary disease. The Army medical team initially thought it was asthma, but all the albuterol in the world did not help. I was discharged under less than honorable conditions, thinking I was the worst soldier in the Army. This was during the time when burn pits were in the news, and after many struggles, the Department of Veterans Affairs confirmed it was chronic obstructive pulmonary disease. I used more inhalers of increasing strength, had constant breathing tests, and saw many pulmonologists who did not believe me. Eventually, a shoulder X-ray revealed the problem. A lung biopsy and diagnosis followed quickly. There is no cure and it is difficult to treat. The average lifespan is 5 years after diagnosis. That was in 2010. I want to point out that I spent a long time around burn pits, but the real danger for me was several deep inhalations of radioactive dust. It was an intentional radiological attack by the same people making improvised explosive devices and shooting at us. I was the one who suffered the worst exposure and was the only one without a nose and mouth covering. Story 28. My father and mother-in-law both had cancer with 0 symptoms. My dad's doctor said, "I don't like that mark on your skin. Let's remove it." After a more extensive surgical procedure, he has been cancer-free. My mother-in-law had cancer removed during a colonoscopy. They performed another one to follow up, and the cancer was completely removed before she even woke up, and they informed her about it. Get your routine cancer checks. Story 29. Weight loss, tiredness, pain in flank, no appetite. The tumor had compressed my stomach. The general practitioner said it was heartburn for 8 months. This is the CT scan. I lost my kidney, part of my stomach, my core muscle, plus other bits and pieces. Luckily, 10 years on, I am still clear. The doctor was ineffective. But before everyone says, get a second opinion. He was the head partner at our doctor's surgery. When I saw other doctors there, they would not go against him. No local doctors' practices were taking on new patients, so it was not ideal, but I am alive, bearing some wicked scars and living the best life I can. Story 30. Ovarian cancer survivor. I just had my second child, and my periods were getting progressively worse. I had nagging back pain, which I attributed to bending down a lot for diapers and everything else that comes with having small children. I went to the doctor for a routine follow-up and suddenly, inexplicably, started to cry. She asked what was wrong. I responded, "I don't know, but can we do an ultrasound? I know something isn't right, but I don't know what." I received a call a day after that ultrasound. There was a 10-centimeter mass on my ovary with suspicious features. Magnetic resonance imaging confirmed cancer. I lost my ovary but was so lucky no chemotherapy was needed. The symptoms were overall mild, and had I chosen to ignore my gut instinct, I suspect I would not be here typing this. Story 31. I was diagnosed last year with severe rheumatoid arthritis, which causes nodules to form in the lungs. I have a few present, all under 1 centimeter, so my doctor performs x-rays every 3 months to monitor them. However, in just 3 months between one set of x-rays and the next, I have developed 3 spots, the largest nearly the size of a peach, that have appeared suddenly and are not consistent with rheumatoid arthritis nodules. I am scheduled for imaging scans on Thursday, followed by a biopsy. I am not certain of anything yet, but I would not have known these spots were there if my doctor had not been doing routine x-rays. The only symptoms I have noticed are a sensation like a lump in my throat, caused by one of the masses pressing on my trachea, and a mild dry cough. Story 32. Absolutely nothing. I went in for a well woman exam and it came back with irregular cells. They said it is likely just human papillomavirus, which will clear on its own. The biopsy said otherwise. Story 33. Family history of cancers of the female reproductive system on both sides of the family. I was told I was too young to worry in my mid-20s, but insisted they check. Sure enough, there were cells just beginning to turn cancerous. After several surgeries, I have been clear for 12 years. Story 34. I started having what I thought were perimenopause symptoms. I was 45, so I figured it was about time. A few months later, my large puppy jumped on my stomach. It started to swell the next day. The swelling progressively got worse over a few days and became very painful. I went to the emergency room and was diagnosed with ovarian cancer. Story 35. I am reading all of this while experiencing severe fatigue and brain fog. Is it allergies, perimenopause, or something more serious? And do I trust my doctors enough to conduct a thorough examination to determine the cause? Story 36. My cousin went to the dentist, and they found sores on the back of her tongue. They suggested she get them checked. Several doctors told her it must be a sexually transmitted disease and refused to perform further testing. A year and a half later, she finally received a diagnosis and spent another year and a half undergoing invasive surgeries on her face and neck at some of the best facilities in the country. However, it was too late. The cancer was a foot long and completely wrapped around her trachea. She died a few weeks ago, a couple of days after her 35th birthday. Story 37. My only symptom was a lump on my neck. It took the doctors months, during which the lump grew to the size of a softball, and a biopsy to diagnose non-Hodgkin lymphoma. All blood work was clear. I was 35 and had just given birth to my second baby 6 months earlier. I have been in remission for almost 5 years. Listen to your body and advocate for yourself. Story 38. My mom couldn't lose weight and she was bloated. She ate very healthily and walked regularly, so it was odd. She had to cough a lot and burp frequently. It turned out to be ovarian cancer, and she maybe lived 2 years. I wish doctors had considered this diagnosis. She was at the age where it was possible. Not enough is known, as many women experience these symptoms without it being anything serious. Story 39. I lost my voice and could no longer sing. I was a professional singer. After 4 months of voice therapy without improvement, a scan revealed a mass. The doctor redirected me to a lung specialist, who found a large mass in my lung blocking my vocal cords. It was stage 4 cancer. I received chemotherapy and continued traveling. Now, almost 2 years after the diagnosis, I am in hospice care, likely with only 2 weeks left. I smoked marijuana for over 40 years and tobacco for a shorter time. I enjoyed smoking and have no regrets, though I am dying younger than I expected at 57 years old. Carpe diem, everyone. Story 40. My sister had low-grade nausea for months, which we initially attributed to anxiety because she has generalized anxiety disorder. Then, one day, the side of her neck began swelling noticeably. It turned out to be non-Hodgkin's lymphoma. She is cancer-free now. Story 41. None. I am in my 5th year of cancer experience, having been stage 4 for 4 years. Although I have no symptoms from the cancer, I have many from the chemotherapy I underwent 4 years ago. I am currently in my 2nd drug trial, which requires a 4-hour drive each way. It is conducted at one of the largest cancer centers in the United States, and I attend every week. No fun at all. Feel free to ask me anything. Story 42. My aunt felt hot and had trouble breathing. She also had a cough. The doctor sent her away with an inhaler, and she passed away 3 weeks later from cancer in the stomach, lungs, liver, and brain. Story 43. My mom was caught in a routine mammogram and required a mastectomy. My grandmother had it too, so after a genetic test showed I carried a harmful gene, I am getting a preventative mastectomy and will hopefully never have to deal with it. Story 44. My best friend had no symptoms at all. She was 23 and grocery shopping one day when she had a seizure that brought her to the emergency room. Scans revealed a brain tumor that had been there for a decade. It had been slowly growing, and one day it pushed against something in her brain, causing the seizure. It has been a very long road to recovery over the last 7 years. Story 45. Nothing. My puppy hit me in the groin, and the pain led to an ultrasound and further examinations. Mine does not show in blood tests either, so I got lucky, I guess. Story 46. My wife was tired a lot, but we had a 3-year-old, a 1-year-old, and we are both teachers. Tired is a normal way of life. One day we were both feeling run down, sick, flu-like. We went out for the day. She said she felt like she was fading. On the train ride home, she closed her eyes, screamed, and had a full-body seizure. Imaging confirmed an area of concern. More imaging confirmed an oligodendroglioma, stage 2. That is a very slow-growing form of brain cancer. The oncologist said it was the best case of the worst thing. It was located in the left frontal lobe. Her surgery was a year ago this week. Her surgical team were incredible. 0 loss of function. She walked out of the hospital 2 days later. A new drug specifically inhibiting the genetic ability of her type of cancer to metabolize and grow was released a month after her surgery. She is in a compassionate care program that gives her free access for life. It is the first drug in 30 years to treat this kind of cancer and slows or hopefully stops an already slow-growing tumor. Her scans have come back clear every 3 months for the last 12 months, and we are hopeful it will be a very long time before further action is needed. These days she is still tired, but that is the worst of it. Cancer is devastating. Thank science. Story 47. My good friend had unusual gynecological and gastrointestinal symptoms for months. Her doctor sent her for tests but found nothing. She would faint just from standing up. One day, the doctor sent her for an abdominal CT scan. She called me sobbing. She had stage 3 ovarian cancer and large amounts of fluid, known as ascites, in her peritoneum. She finished her nursing degree and worked as a school nurse while undergoing treatment. Ovarian cancer is mostly a silent disease and has a very high mortality rate. I miss her. Story 48. I had a big lump protruding from my chest, about 1 inch in diameter, that did not go away and appeared suddenly overnight. I thought it was hormonal, so I stopped taking my birth control, but the lump remained. I went to my doctor, who thought it was a lipoma or fibroma because it was mobile, somewhat soft, and did not feel like a cancerous tumor is described. He referred me for a mammogram to ensure it was nothing serious. Turned out to be something serious. Story 49. Answering on behalf of my deceased grandfather to help spread awareness. He had a lump in his breast and some extra fatigue, although he had other health issues. Men can get breast cancer. Check your pectoral muscles, especially if you are larger or have gynecomastia, because lumps are easier to ignore then. He was an introverted, proud Vietnam War veteran and did not want to face embarrassment or bad news. By the time he told me and my mother, the lump was the size of a golf ball and as hard as a rock. It grew daily while we watched, and he passed away within a month and a half. I am grateful that he allowed us to care for him despite his feelings of humiliation, and grateful that he died right before it became fumigating. Check your chest. Story 50. My grandfather went to get up from a chair and his lower arm just snapped. He had bone cancer, a rare aggressive form, and died 9 days later in agony. Bones started breaking with every movement. In the end, his ribs would break just from breathing. Finally, they were collapsing under the weight of his body. The local doctors knew of only one other case like this, which was my grandfather's brother-in-law, who grew up in the same neighborhood in another city. Story 51. Not currently, but I had it last year. Found a lump in my testicle. I immediately knew what that could mean, so I got it checked out as soon as possible. Story 52. I was experiencing increasing pain in my testicular region over the course of about 3 to 4 months. At first, I thought I had slept wrong or injured myself playing sports. That was until I started to have breathing pain. I was diagnosed with stage 3A testicular cancer. I recently celebrated 9 years cancer-free. Story 53. Mom was burping a lot and experiencing some heartburn. The doctor decided to perform an endoscopy and discovered she had a rare cancer with a low survival rate. That was 7 months ago. She has undergone chemotherapy and had her stomach removed, but she seems to be doing better now. She was fine otherwise, but she was very close to death during chemotherapy. Story 54. My best friend died of colorectal cancer. She had bleeding after bowel movements for 8 months before she told her doctor about it. She had assumed it was hemorrhoids. Her doctor was very concerned when she finally said something. She was already in stage 4 when the cancer was discovered, having spread to her lungs and liver. She lived another 2 years. The period around her death remains one of the darkest times of my life. Story 55. My brother had bleeding and pain when he used the bathroom. He was in his late 30s or early 40s, so they attributed it to irritable bowel syndrome. They recommended a colonoscopy, which he did not get. He later found out when his colon perforated because it was riddled with tumors. A year later, he passed away. Colorectal cancer is affecting younger people. Ask for a colonoscopy if you have symptoms or a family history. The preparation is not that bad, and the nap afterward is great. Story 56. My grandmother experienced shortness of breath, and her general practitioner sent her to the hospital when antibiotics for pneumonia did not work. He suspected bronchitis. She was diagnosed with small cell lung carcinoma and passed away 6 weeks later. The only treatment option was chemotherapy to extend her prognosis from 3 to 6 months, but she declined because of the side effects. She was not in pain, only had shortness of breath. She was 80 years old and had been smoking heavily since the age of 15, so her family was not surprised by the diagnosis. Story 57. My right testicle was significantly larger and more painful than my left one. My girlfriend said she was going to break up with me because she thought I had chlamydia. It was not chlamydia. It was testicular cancer. For months later, she left me during my 3rd round of chemotherapy because I was not giving her enough attention. I overcame 2 challenges at once. Story 58. My husband had a headache for 2 weeks. He hardly ever got headaches. We went to the emergency room to get it checked out. It was glioblastoma, an absolute shock of our lives. He is in his early 40s, almost a year into this nightmare, and he is stable for now. I cannot even begin to describe what the shock of your life being turned upside down in an instant does to you mentally, physically, and emotionally. Story 59. My lymph nodes started to swell, then my neck began to swell, and I started to experience reflux and coughing fits at night. I went to the doctor, and he told me I was tense and needed a massage. A month later, I was admitted to the hospital with blood clots in my lungs, fluid around my heart, and a stage 4 non-Hodgkin's lymphoma diagnosis. I will have been in remission for 3 years this fall. If something feels off, advocate for yourself. Story 60. I started having severe pain during my periods, the kind that requires a visit to the emergency room and causes vomiting while waiting. Story 61. Get a yearly physical. Saved my husband's life. His kidney cancer was detected while checking high creatinine levels. It had nothing to do with the cancer, but it led to a magnetic resonance imaging scan that found it. He had 0 symptoms. Story 62. Constant dry cough that did not go away for months, night sweats, feeling like I had the worst allergies ever even though it was the middle of winter, then increasing difficulty breathing. It was like trying to breathe through a wet sponge. It was a malignant neuroendocrine tumor in a lung. It is believed to have caused a massive histamine release. Normally, these do not cause symptoms. Story 63. I mentioned to my mother and girlfriend that my throat had hurt during dinner one day. Then COVID-19 occurred, so there were no doctor appointments, and the pain was not severe. A few months passed and the pain went away. I had a doctor appointment unrelated to my throat, and my mother was with me. She brought up my throat pain from 2 months earlier. I told the doctor that was months ago and it did not hurt anymore. However, he felt my neck and found a bump. He said, "Let me send you for a scan." The scan came back suspicious, so I had a biopsy done. Came back 99% cancer. Apparently, there is no way to know for certain if it is 100% cancer until it is removed. Story 64. I had 2 episodes of seizures in my sleep. My then girlfriend was thankfully there, and it woke her up. They originally misdiagnosed it as a stroke, but after the follow-up scans weeks later, it was revealed to be a brain tumor. Story 65. I do not have cancer anymore, but when I did, my skin had a gray tinge, and I was extremely lethargic. Edit, I had leukemia. Story 66. My sister, who was 15 at the time, had acne that was flaring up and was about to start high school. My mom took her to the dermatologist. They asked about a pink wart on her arm that had been there for a couple of months. It seriously looked just like a deep pink wart. It was melanoma. The doctor said if she had waited a month, they would have removed her arm, and if she had waited 3 months, it would have been too late to treat. Avoid using tanning beds. Story 67. I took a knee to the side while working with a disabled client. Caused a lot of pain, so I went to have it checked out. They performed an X-ray and a computed tomography scan and said they were bringing in a doctor to review the results. 10 minutes later, they told me I had testicular cancer. After several chemotherapy treatments and an orchiectomy, I have been cancer-free for 11 years. Story 68. Not me, but my father. He had the influenza that would not go away. It turned out to be metastasized melanoma. He died 5 weeks later. Story 69. I had night sweats and enlarged lymph nodes in my neck. My resting heart rate was 120 beats per minute. I was diagnosed with stage 3 Hodgkin lymphoma after delaying going to the doctor for months. I really wish I had gone sooner. Story 70. My wife complained of seeing shapes and different colors obscuring her vision. I thought her eyes were strained from too much work on the laptop and told her to rest. The next day, the vision disturbance was gone, and she was watching television in the living room when suddenly she had a full-blown seizure. It was nothing like what you see on television. I thought she was having a heart attack. When we first arrived at the hospital, they could not give her a magnetic resonance imaging scan, only a computed tomography scan, which confirmed she had a tumor at the back of her brain. After 2 days in the intensive care unit and several scans later, they found a mass in her right lung. The prognosis given by the oncologist was 6 to 12 months. That was nearly 9 years ago. She walked out of palliative care treatment after 2 years and refused to return for any scans or checkups. Story 71. My uncle was diagnosed with stage 4 lung cancer. He had shoulder pain for a year. There were no X-rays or other tests from his primary care physician. He was sent to physical therapy even though he had a history of working with asbestos for many years. It turned out to be a large, inoperable lung mass. He passed away 3 months after his terminal diagnosis. Doctors need to listen to their patients. He felt that something was wrong, and he was right. Story 72. My mother had a deep, thick cough for about a month. She also had stomach pains, so she was cutting out dairy. It turned out she had stage 4 ovarian cancer, and her lungs were filling with fluid, which is why she had the bad cough. Cancer is a terrible disease. Story 73. My nipple was bleeding, but the liquid was brown. I did not realize it was actually blood. I searched my symptoms on an online forum, and someone had a similar experience, so I decided to get it checked. I was diagnosed with stage 1B breast cancer at 29. It has been 4 years cancer-free. Story 74. My then 6-year-old was diagnosed with cancer last September. The symptom that led to his diagnosis was persistent pain in his right knee. His primary care physician ignored my request for imaging and X-ray. We took him to an orthopedic specialist. The look on his face after he saw the X-ray immediately told us something was wrong. A tumor was found in his right knee and a large mass in his abdomen. The good news is he is better now. It turned out that my son faced one of the toughest situations with remarkable resilience. Story 75. My mother's nipple inverted, and I urged her to see a doctor. She was diagnosed with stage 4 breast cancer but thankfully survived for a decade longer. The cancer returned with a persistent cough she could not shake. She had lost many of her ribs and spine to metastases at that stage, and they had to be rebuilt with metal. We gained 3 more years after that. Story 76. A strange lump appeared on my jaw while I was shaving. After 10 doctor appointments, I was diagnosed with lymphoma. Story 77. Dad died of pancreatic cancer. He complained of a lump in his abdomen for a while before being diagnosed. He died 6 months after diagnosis. Story 78. I had painless lumps in my neck. Something in my gut told me to get it checked. I had stage 3 Hodgkin's lymphoma. That was 42 years ago. Yes, some cancers are curable, thank God. Story 79. Leukemia started with light weight loss and fatigue that I attributed to stress. Then I began experiencing severe leg pain. The pain started spreading to my bones but remained consistent. My teeth would hurt so badly that I barged into my dentist and begged them to remove my permanent retainer, which brought instant relief. My skull, one kneecap, and then the other leg hurt. The pain traveled around my body. Doctors initially suspected rheumatoid arthritis. Later, I developed random swelling in my limbs and spots on my ankles. By the time I had a computed tomography scan, they called me an hour later and said, "You need to drop everything and go to the emergency room right now." 85% of my blood cells were cancerous, and I had sepsis. My girlfriend said I had been smelling weird for weeks, and my pets were clinging to me all day. Turned out I was almost dead. Story 80. The two main signs I had were severe back pain that left me unable to get out of bed when I was 11 years old. I missed school occasionally because of how bad it was. The other symptom was recurring fevers with no known cause. I would get fevers like clockwork once a week for a day or two. There were no other symptoms with the fever, such as cough or runny nose, just the fever. Later, I found out that the dark circles under my eyes were a symptom as well. Doctors growing up would say it was allergy-related or genetic. Even though I am cancer-free now, I still have the dark circles under my eyes, so I do not pay much attention to that symptom. If anyone is ever worried about it, it never hurts to ask for a simple urine test, also known as a tumor marker test, to check for cancer. Story 81. I had leukemia. Extreme fatigue. I was so tired that all I did was lie around all day and sleep, which was unusual for me because I was usually an energetic kid. General pain. Moving around caused me pain, particularly in my joints and bones. My lymph nodes were swollen and those hurt too. Infection. I developed a skin-eating infection on my back from bacteria that do not normally cause infections in an otherwise healthy person. Fever. I had constant fevers that could not be kept under control. The highest it reached was around 105 degrees Fahrenheit. Easy bruising, paleness, and the doctor just kept telling my mom it was a virus. Story 82. My mom had severe pain shortly after an injury. She felt a lump, but for months doctors told her it was just a muscle knot. Eventually, she ended up in the emergency room and was put on morphine for the pain. She was initially told to take acetaminophen. It turned out to be stage 4 melanoma. She had been in remission for 5 years before that. She insisted on a scan just to check, against her doctor's advice, but it was booked 6 months out, by which point she would probably have been dead. Luckily, she was able to get emergency scans and is doing all right now, at least not in such terrible pain. Story 83. I had chronic diarrhea for 6 months, which is not unusual because I have Crohn's disease. It was a little strange because my body has always responded to treatment. Months went by, and the gastroenterologist ran different tests to rule things out. This past December, I started to have pain in my back after eating. I went to the emergency room, thinking I had a gallbladder issue. The computed tomography scan showed lymphoma that started in my small intestines and spread to one of my kidneys. This caused my bowel to perforate, and I had to have 3 feet of my intestines removed. The main tumor was the size of a grapefruit, and they said that if I had not gone to the emergency room, I would have been dead in weeks. I recently finished chemotherapy and have my all-clear scan in less than a week to see if I am cancer-free. I am extremely lucky to be alive and very grateful to still be here. Story 84. I lost a lot of weight on purpose, and because I lost a lot of fat in my breasts, I was able to find a lump that I would not have otherwise discovered early. I was 34. That weight loss saved my life. Story 85. My hypochondriac self should not be here. My dad was sick for months and had severe pain in his feet and legs to the point where he could not walk. The hospital did not take him seriously, and to keep a long story short, he had to have both of his legs amputated. Waldenström macroglobulinemia caused cryoglobulinemia. He also could not eat for months. He pretty much lived off cups of tea, lost a lot of weight, and would twitch in his sleep. His body was slowly shutting down. Story 86. Dad complained of back pain on a Saturday. He woke up on Sunday with increased back pain and the whites of his eyes were yellow. He went to the emergency room. They sedated him for a magnetic resonance imaging scan because he had severe claustrophobia. The scan diagnosed him with metastatic pancreatic cancer. He developed sepsis and died a few days later. The oncologist had witnessed his father die slowly over 18 months from pancreatic cancer and said it was somewhat of a blessing how my dad passed. I completely agree. I watched my brother-in-law fight and eventually die from esophageal cancer. It was terrible. Chemotherapy is very difficult to endure, and dying slowly from cancer can be excruciatingly painful. Story 87. Ovarian cancer. I had no clue. After I received my diagnosis, I realized I had to urinate frequently, was bloated, and had been feeling nauseous. Story 88. I felt a lump in my underarm. The cancer had spread from my breast to my lymph nodes. I did not feel it in my breast. The tumor was much smaller there, located just under the nipple, which my surgeon managed to save. Story 89. My mother's tongue started swelling, and she began having trouble speaking clearly. A tongue biopsy found nothing, and she did not get answers for months. Eventually, she developed digestion issues and went to the emergency room several times. The last time she went to the emergency room, she also fainted, and her heart was racing. After weeks in the intensive care unit and further testing involving a bone marrow biopsy, she was diagnosed with stage 3 multiple myeloma. She had been trying to tell her doctor that something was wrong for months. Story 90. Stage 4 desmoplastic small round cell tumor. Experienced fatigue and constipation. Underwent a scan due to unusual symptoms which revealed multiple tumors. Recently, 200 tumors were removed from the abdomen and pelvis during a 10-hour operation. I never thought it could be cancer. Story 91. Last February, my mom started having severe stomach pains to the point where she could barely move and over-the-counter pain medication would not work. She initially refused to see a doctor, but I convinced her to go to urgent care. Once we got in the car, I changed my mind and decided it was better to take her to the emergency room instead. Hours later, after a CT scan, a large tumor was found in her colon. It was diagnosed as stage 3 colon cancer, and she is doing well after chemotherapy. She had no other symptoms and had a colonoscopy 3 years prior that was clear. I always wonder if it would have been found if I had stuck with my first plan to take her to urgent care, or if they would have just given her pain medication and sent her home. Story 92. I did not have any symptoms and did not feel anything during routine self-exams. My cancer was found through a mammogram screening. I had dense breast tissue and was told I needed a biopsy to determine if what the mammogram showed was cancer, a calcification, or just regular dense tissue. The lumps they found at the time were no bigger than small pellets. I had 3 on one side and 2 on the other. One was close to the inside portion of the nipple, and the others were a little deeper. Between the original mammogram and my surgery about 5 months later, the lumps had tripled in size. 2 years later, after a double mastectomy, I am cancer-free and no longer need mammograms. They told me they removed all the cancer and that I would not need chemotherapy or radiation, which was the main reason I chose the mastectomy in the first place. Story 93. While walking, I noticed that my shadow had a lump on the side of its neck. For some reason, I could barely see it in the mirror. Story 94. Unexplained back pain persisted for months and could not be linked to any specific injury or problem. Then there was weight loss. I had non-Hodgkin lymphoma at age 25. I was a new mother, always tired, holding a baby all the time and hardly sleeping, so I assumed the pain was normal. My new rule is to see a doctor if a symptom lasts more than 2 weeks. This applies to almost every type of problem. Most minor injuries and illnesses improve within 2 weeks, but cancer does not. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.